Many men notice that blood pressure doesn't behave like it used to. It may look normal one moment, then rise the next. This can happen even when you're resting, or sitting quietly, or doing nothing stressful at all. That can feel confusing. It can also feel unsettling, especially when you're trying to take care of yourself and follow advice. What makes this harder is that these changes don't come with clear reasons. One day, the numbers seem stable. The next day, they jump without warning. For many men over 45, this starts to feel unpredictable, almost like the body isn't responding the way it once did. In this video, we're going to slow things down. We'll make sense of what's happening inside the body when blood pressure rises and falls like this. Nothing extreme, nothing complicated, just a clear look at why these shifts are common and why they often have less to do with age alone than most people think. For many men, the most confusing part is that these changes don't match how they feel. You may not be anxious or angry or physically active, yet the numbers still rise. That disconnect makes it hard to trust your body. It can also cause more worry the next time you check your pressure. Over time, this can turn into a cycle. You see a higher reading, your attention sharpens, then the body reacts, even though you're not trying to make anything happen. The pressure doesn't rise because you did something wrong. It rises because internal systems respond on their own, without conscious control. Once you understand that these shifts come from internal signals working quietly in the background, things feel less random. It starts to look like a pattern, even if that pattern was never explained clearly before. And when something follows a pattern, it can be understood in a calm and practical way. What's important to understand is that this response is not a sign your body is failing. Often it's the opposite. It shows the body is reacting quickly to signals it thinks matter, even when those signals don't feel obvious. That's why blood pressure can rise during quiet moments, or at a doctor's visit, or late at night when everything seems calm. Many men are told to focus only on numbers, or medication, or age, but that doesn't fully match what they feel day to day. The body doesn't work in separate parts. It responds as a whole. It adjusts heart rate, vessel tension, and pressure based on how safe or alert it thinks you need to be. When you see it this way, sudden changes make more sense. They are not random. They are not personal failures. They are part of a built-in response system, a system that has been working for decades, even if no one ever explained it clearly and simply before. This is also why blood pressure can act differently based on where you are or what you're about to do. Sitting in a waiting room, thinking about a reading, or waking up suddenly at night. All of these can quietly change how the body responds, even if you feel calm on the outside. The change starts inside, before the numbers ever show it. For many men, no one connects these moments together. They're treated as separate events, but in reality, they're part of the same internal process. The body is always adjusting, tightening or relaxing without asking for permission, based on signals that are subtle and automatic. Once you see that these shifts follow a steady internal rhythm, things feel less mysterious. Instead of being surprised by each reading, you begin to understand why it moves, and that understanding alone can change how you experience this going forward. What often goes unnoticed is how fast these internal responses switch on and off. The body doesn't wait for permission or logic. It reacts in real time. It follows signals that formed long before numbers and monitors existed. That speed is useful in real danger, but it can feel confusing when it happens during normal moments. Because this happens automatically, many men think there's nothing they can do. They wait, they worry, or they rely only on outside control. That belief alone can make the situation feel heavier than it needs to be. When something feels out of control, attention sharpens. The body becomes even more alert. Once you see that these responses follow internal rules, not random chance, things feel more stable. The problem shifts from unpredictable to understandable, step by step, and understanding helps the body settle instead of staying on constant alert. There's also a common misunderstanding that these reactions mean something is permanently wrong. In reality, They often show how sensitive the body has become to certain signals over time. Years of stress, habits, and routines quietly train the system to respond faster than needed, even when the moment doesn't require it. This is why two people of the same age can have very different experiences. One may see steady readings. Another may notice sudden changes that seem to come from nowhere. It's not about willpower, it's not about discipline, it's about how the body has learned to react, often without anyone ever explaining it. When you view blood pressure this way, it stops feeling like a mystery or a personal flaw. It becomes a response with a cause, with a direction, and with a pattern. And once something has a pattern, it can be approached calmly, without fear, without confusion, and without feeling rushed to force an answer. This is often where frustration begins. You're doing what you were told, you're watching the numbers, yet the experience still feels uncertain. The readings don't always match your effort. That gap can slowly build tension, even if you don't see yourself as stressed. What's happening underneath is not random, and it's not sudden. It comes from how the body balances alertness and calm during the day. That balance can shift quietly, without noise, without warning. This is more likely after years of reacting to pressure, deadlines, or health concerns. When alertness stays high for too long, the body treats normal moments as if they need a response. That's why numbers can rise during quiet times. Not because something new is wrong, but because the system hasn't fully settled yet. Understanding this prepares you for what comes next, and why certain approaches can help without forcing the body or overwhelming it. Many men notice that once they become aware of these changes, their focus moves to the next reading. That attention alone can gently affect how the body responds. It's not imagined, and it doesn't mean you're causing the problem. It simply shows how responsive the body is even to small signals. This responsiveness is not good or bad on its own. It's just how the system works. The problem is that no one explains this clearly, so the experience feels confusing instead of logical. Without context, every higher number feels like a warning, not a signal that can be understood. When this connection becomes clear, things begin to change. Blood pressure is no longer just a number that appears without reason. It becomes part of a bigger picture, a picture of how the body reacts, settles, and adjusts during the day. And once that picture is clear, it opens the door to calmer ways of working with the body instead of feeling stuck reacting to it. This is why focusing only on controlling numbers can feel tiring. The body is not a machine that obeys commands right away. It's a system that reacts to how safe or alert it thinks you need to be, moment by moment. When that system stays slightly tense, the numbers show it, even if everything else feels normal. Many men are never told that this response can change without pain or warning signs. So when it happens, it feels personal, like something is slipping out of control. In reality, it's often the body staying alert longer than needed, not because of danger, but because that's what it has learned over time. Once you see that this process can shift as the body settles itself, the problem feels lighter. It becomes something you can approach calmly, without pressure, without urgency. And that calm understanding prepares you to see why simple approaches can help the body reset instead of pushing harder or fighting it. At this stage, it helps to pause and look at the full pattern. Blood pressure isn't acting on its own. It responds to how the body handles tension and release during the day. When that release doesn't fully happen, the body stays slightly ready, even during times meant for rest. This is why trying harder or watching things more closely doesn't always help. Sometimes it does the opposite. The body notices the focus and stays alert. The response stays active. That can feel frustrating, especially when you want to feel calmer and more stable. What matters most is knowing this response is not fixed. It is flexible. It changes based on signals the body understands well. Once you see how the system moves between alertness and calm, it becomes easier to understand why gentle approaches can guide it back to balance instead of pushing against it or ignoring it. For many men, no one explains that the body responds more to patterns than to single moments. It remembers how often it had to stay alert. Then it adjusts on its own. That memory can keep certain responses active longer than needed, even when life feels calmer now. This is why the experience can feel inconsistent. Some days the body settles easily, other days it holds tension without a clear reason. It's not because you did something wrong. It's because the system is reacting out of habit, not logic. Once you understand that these reactions are learned and automatic, the situation feels less intimidating. It no longer feels like something happening to you. It feels like something that follows clear internal rules. And when those rules are understood, you can work with the body in a calmer, more natural way instead of reacting only to the numbers. This understanding changes how the problem feels. Instead of seeing blood pressure as something turning against you, it becomes easier to see it as a response that hasn't been given the right signals to fully settle. The body isn't broken. It's following patterns learned over many years. When that idea clicks, much of the fear around readings begins to fade. The numbers stop feeling like a verdict. They start to feel like feedback. They show how alert the system is in that moment. They are not predicting the future or defining your health as a whole. This matters because when fear drops, the body often responds on its own. Calm doesn't come from forcing change. It comes from understanding what the body is reacting to and why. That understanding prepares you to see how gentle shifts can help the body return to a steadier, calmer state. Now that this makes sense, let's talk about something simple you can feel working right away. This isn't about forcing the body. And it's not about doing anything extreme. It's about giving the system a signal it already understands so it can settle on its own. One of the easiest ways to do this is with slow, controlled breathing, not deep or dramatic breathing, just steady breathing that gently moves the body out of alert mode. When breathing slows in a certain pattern, the nervous system gets a clear message. It understands that it's safe to relax even if nothing else has changed. We'll start with a basic rhythm that feels comfortable for most men right away. There's nothing to memorize, nothing to push. You're simply guiding your breath a little slower than usual and letting the body respond naturally instead of staying on edge. This first method is about slowing things down in a natural way. You're not trying to control every breath, you're just giving it a gentle structure so the body can sense a calmer pace. As that pace settles, the heart and blood vessels often follow without effort from you. To do this, breathe in through your nose for a few seconds, then breathe out slowly through your mouth for a little longer. The longer exhale matters. It helps tell the body to relax. You may feel your shoulders drop or your chest soften. That's a sign the system is responding. There's no rush. Sit comfortably. Let the breath move at its own speed within this pattern. After a few cycles, many men feel a sense of steadiness return, even before checking any numbers. That calm feeling shows the body is shifting gears, and it's a good place to start. This approach works best when you treat it as a short daily reset, not a one-time fix. Think of it as a gentle reminder to the nervous system, a reminder that it doesn't need to stay on alert all the time. Even a few minutes can be enough for that message to settle in. Many men like to use this rhythm at familiar times, after sitting down, before checking pressure, or when the body feels tense for no clear reason. Nothing dramatic needs to happen. You're not chasing a result, you're simply letting the body respond in its own time. As this becomes familiar, the breath slows more easily on its own. The body recognizes the pattern and settles faster. That's why this first method is often called foundational. It creates a steady base that makes everything else feel easier and more natural. This next approach helps when pressure rises from stress or anticipation, for example, before an appointment or during a busy part of the day. It's still gentle but a bit more structured. It helps the body find a steady rhythm instead of reacting in short bursts. With this method, the goal is smooth, even breathing. Breathe in slowly through your nose, then breathe out at the same steady pace. There's no holding and no forcing. The focus is consistency, so the body can match that rhythm and slowly release tension. As you continue, many men notice their breathing becomes quieter and more relaxed. The body responds to that steadiness by easing the signals that keep pressure high. It's a small shift, but it can make a clear difference when stress or anticipation pushes the system out of balance. This steady breathing works well because it gives the heart and blood vessels a clear pattern to follow. When the breath stays even, the body often matches that rhythm. Pressure can settle without effort or strain. You don't need to slow the breath much, you're just keeping it even. Many men use this while sitting quietly, or waiting in a car, or before checking blood pressure. Because it's subtle, you can do it anywhere without drawing attention. The body still responds to the calm rhythm, even in moments that usually cause a rise. After a few minutes, a sense of balance often returns. The breath feels smoother, the chest feels less tight, the body stops bracing like it was before. That steadiness is what makes this second approach helpful in everyday moments when stress quietly affects the numbers. There's one more approach that helps during sudden spikes, times when the body feels keyed up and the numbers rise fast. These moments can feel unsettling, but they usually come from the same internal response, just acting more strongly. The goal here is to calm that response as directly as possible. This method uses gentle focus and controlled breathing through one side of the nose at a time. It may feel unfamiliar at first, but it's very effective at slowing alert signals in the body. When the airflow changes this way, the nervous system gets a clear message to settle. There's no need to rush or force anything. Sit comfortably. Guide the breath in a calm pattern. Let the body respond. Many men notice their heart rate steadying and the feeling of pressure easing within a few minutes. This approach is for moments when you want the body to quiet quickly and safely without adding tension or pushing against it. This approach is best used when the body feels overwhelmed and needs help settling fast. You don't have to use it all the time. Think of it as a support tool for sudden rises when you want to feel calm again. As you guide the breath this way, the body starts to move out of its heightened state. The racing feeling eases, the breath slows on its own. Many men find that a few minutes is enough to take the edge off and bring the body back toward balance. What matters most is staying gentle. There's no need to force the breath or rush anything. The body responds better when it feels guided, not pushed. That's why this method works well in stressful moments. It helps the system calm itself instead of staying stuck on alert. When you look at these approaches together, each one has a different role. One helps the body settle each day, another supports balance during normal stress. The last is there for moments that feel more intense. None of them replace what you're already doing. They work alongside the body's natural systems. What matters most is consistency and awareness, not effort. These methods are meant to fit into your life easily. They don't add pressure or complexity. Over time, the body learns these signals. It starts to respond faster and with less resistance. As you continue, focus on how your body feels, not just the numbers. When the body feels calmer, the readings often follow. Understanding this connection gives you a steady way to support your health, using something you already have and can use whenever you need it.